Well, hey everybody, this is Joe along here with Dr. Ennis. Good
Hey,
morning.
hey.
Hey, so as we're getting the stuff over at Ennis Chiropractic fired up this morning, we were having an interesting little conversation, and actually it turned out to be such an interesting one that I asked Dr. E if we could go ahead and throw the cameras on real quick and just re-record it because it helped me, and I think it'd help a lot of other folks. And it all started with this right here, this actual mug. Dr. Ennis noted that was filling it up like the third time before 8:30 this morning. Which now I do like my coffee. I like it a lot. I really want to sip some right now because it's still kind of warm. But he brought up an interesting point, and I told him, I've made the joke a couple times recently. January was kind of a long year this time around. Everything feels like it's kind of dragging out for the last couple of weeks. And I know the weather's been kind of cruddy, and but I've just felt not quite myself. So I'm drinking a lot more coffee. I'm back to buying Red Bulls at the gas station every once in a while, which I know I shouldn't be doing. And it's not even that it's putting me in hyper mode. Like I feel like I need all this extra stuff just to get to like par, just so that I can function and answer the phone and pay attention to what people are saying. I found myself making a lot of mistakes and kind of like I'm skipping a step or I'm missing a gear in the system. And I mentioned that this morning, and it was really interesting because I don't always think about it as here's a problem I'm having, and he always happens to have a fix for me. But lo and behold, he does. So, Dr. Ennis, would you mind just sharing for the folks on watching our video here what you told me that was kind of kicked off this whole conversation? As
Yeah,
I do
well,
get to sip my coffee now.
yeah, at least it's not Red Bull though. So yeah, we talked about how that fogginess in the head and that trouble remembering, that scattered feeling, that sluggish type feeling. Well, we see that a whole lot. And so, you know, the issues with that stem from a lot. But one of the things reminds me of a patient we had not too long ago. And in fact, she's a prominent businesswoman and has lots of other issues, but her main concern was the fact that her memory was slow, her head
Mhm.
felt sluggish, she had poor energy, couldn't sleep, and so she started our nuclear program for that specific reason only. And it turns out when there's pressure on the brainstem, it also causes pressure inside the skull, and
Oh,
so and the nourishment doesn't get to the cells quite as readily, and so they get this feeling of there's brain fog and there's sluggishness, and they just can't function as well as they should. And after a while, people begin to believe it's psychological stuff, but it really actually is chemical and mechanically oriented. And a simple adjustment at the atlas and lining that up lets that pressure off. And it's just really quite amazing to see the difference. And when I noticed you with your coffee, well, I just thought that's something probably we should be talking about.
yeah. And by the way, I'm not going to give up the coffee. But
Understand?
that illustration was an interesting point, and in my head, I almost think about it like a slow draining sink. Like in my house, I backed up my kitchen sink the other day because I decided I was going to cook something fancy, and put a couple things down the disposal I shouldn't have. And so the faucet. I guess maybe I'm thinking of this as like my thoughts and communication to the rest of my body coming out, but when it's hitting that drain pipe like the atlas and the central nervous system, it's kind of getting stuck.
That's
Right?
exactly
That
right. It's well
close.
said. Yeah, it's perfect. Yeah, right on.
I think in pictures, and I think of things that that happened to me in my own experiences. It just makes it easier for me to
Joe,
understand.
Red Bull though is not like the plumber's stuff. It doesn't clear it out.
It's about as
Unfortunately,
corrosive
that's
as
suggested.
Drano is. You know, maybe that's how I'll get rid of the rest of that little pack I bought. I'll just dump them down the sink and let them eat away at everything that's
It'll have
down
the
in
same effect.
there.
Exactly.
Oh, geez. So, okay. So, that helps me kind of better understand it, of these are real issues
Right.
that, first of all, that's the first point, right? These are real issues. This,
They
this
are,
isn't
and
a
they're not
perception
mental. They're actually the physical issues that occur. That's exactly right. And in fact, it's one of the most common things we see that a person can notice because pain up the upper cervical area is not super common.
thing.
The first things that happen are some of those physiological changes, slowness, changes in moods, those types of things. Even some studies are relating depression type things as a consequence of this upper area going off. So it's actually,
Oh,
it's
wow.
really a big deal. People don't know. And there's a lot of research actually backing that up.
So help me connect the dots then.
Uh,
If I'm feeling a little bit slow, or if I'm feeling foggy, uh, fatigue, those sorts of things, like what's that process look like?
Well, you know,
If I
so
actually want some relief.
yeah, sure. So first thing is the things you can control. Well, obviously the Red Bulls are spiking your system, and
Yeah.
the coffee, of course, because I know yours is not decaf. But you know, so those, you can control those things. What we want is an even burn. So your diet, nutrition, super important. Make sure you're eating enough protein to where your sugar's not dropping and spiking. That's something that can help. As far as the physical stuff goes, well, if your atlas is off and it's causing the pressure to build up in your skull, well, that's something that has to be relieved. So that's something obviously we're gonna have to adjust.
Mhm.
But after that adjustment, or even before, posture is huge. If you keep your posture up, it gives you the best chance to circulate and to flow right. And I highly recommend, you know, you look at it that way. How can I improve my posture? That'll help. That'll help that part of that system work better. Even
Mhm.
before your adjustment, it'll be better. But certainly, post is something we actually demand.
Okay, gotcha. And if I come into the office with some of these issues, so I'm thinking more about my posture. I'm trying to be a little more self aware. I'm ready to look for a solution here.
Perfect.
Is this, to go back to my sink analogy? Is this like a plumber's call where they come in? Do you come in with your plunger, clear it out, and it's done, and I don't ever have to see you again? What's the process look
Well,
like
yeah.
if
So
I
that's
want
the
you
thing.
helping me?
So certainly, in some ways, we're like the plumber in the sense that we're going to remove that clog.
Okay.
But the problem with the drain and the body is that they're totally different. A body is under constant stress, lots of different dynamics, and and as you know, the stress will build up day and day. So it probably needs a little bit more attention than most, but an ounce of prevention is worth a pound of cure, as you know, Joe. And so
True.
I'm a big advocate of that. And I always like to make sure that our patients, you know, they realize and keep in mind that it's a journey. Your health is a journey and not a destination. So
Hmm.
that you know, a lot of people like to believe it's a destination. Well, once you have no symptoms, you're that way for the rest of your life. Well, you know, the reality is not it. You really need to keep in mind that it's a continual journey, and the trick is to stay on the right path. I'll give you a real quick example of that. A recent study came out on people that work out, and you can actually measure the muscle cells. You can measure the stamina and the strength that they have. And so they took these individuals that had been working out for a year consistently straight, and
Hmm.
then they asked them to stop. So when they measured the cells during that consistent period, they measured a certain amount of strength and stamina. When they stopped for 2 weeks, it decreased 41% in both stamina and strength in
Wow.
2 weeks. And so people go, oh my gosh, and does that mean I have to work out forever? Yeah, in some form or fashion. If you don't, your body's going to respond like those cells do. And so that's the thing we recommend. Take your health as a journey. It's a lifelong journey, but if you do it that way, you're rewarded with experiences that you should have, that you want to have. At least that's what we want for you.
Sure. That's really interesting. And that reminds me, because we were talking about that study, and there was a partner study to it that, as part of the analysis, and this was something that I thought was also particularly
Yeah.
interesting. When somebody takes the time to build that muscle mass, that muscle memory in their body, and then they stop, right?
Right.
And then there's a degradation process. What was interesting for me was when they started working out again, or getting back in shape, the remediation process was much faster than the original build. So,
Yes.
once you build that good health, good lifestyle in your body, and you get away from it, it's not, if it took you a year the first time around, it doesn't take you a year to get back where you were.
No,
So,
it's relatively quick. That's right.
yeah, and that, to me, that's a really important idea of why you want to take action now, right? When
Right.
you take the time to get your body aligned, when you go through your adjustment process, and it's like building that muscle, so that
That's right.
when people come back in, they get better results more rapidly in most cases. Obviously it's not a guarantee,
Right.
because they've taken that time. So you can wait until you're at the point of no return. You're in tremendous pain, or you can't think straight, and it's, you get fired from work because of something silly that you should have been able to address. You wait till it gets super super bad. There's still a process to get to get you on the right track.
That's
That's
right.
something we can help with. But if you take time now before you get really bad, you can maintain that. And even if you do, miss an appointment or two every once in a while, coming back in, as long as you're not just completely walking away from it, there's benefit, right?
Absolutely. Yeah, that's 100% the truth. And you know, that's how life is too, isn't it? And life is going to throw us some curveballs where we have to not pay attention to our own health. Maybe we're paying attention to a loved one or what have you. And
Hmm.
that's just how it is.
Yeah.
But if you've been pretty good about taking care of yourself, it's a quick return back to that level. And I think that's a great point, actually.
Yeah. Well, I've won every once in a while.
Yeah, it's scary.
I've contributed my capacity for the week, so I'm ahead home now.
Wow.
Well, cool. Well, hey, listen, Doc, I appreciate we were able to take a couple minutes and kind of talk through this. And again, just as a quick recap, people that are slow to wake up, you feel like you're putting too much caffeine in your body, you don't quite feel yourself. Your things are taking longer to process. You're making mistakes you shouldn't. You can't remember where your keys are more often than not. Those are kinds of issues that we really do want to see in the office right now.
That's right.
We're
Those are
looking for.
exactly the kind of things we're looking for. That's exactly right.
Yeah. Okay, great. All right. Well, let's get back after it. Everybody out there, if you have any questions or any comments or feedback, please let us know. Drop a comment down on this video. We take those comments and make sure that we get answers to everybody because we don't want you to have to go out into Google and just search around for answers because generally they're not all that accurate. We've got a doc here on camera who's always happy to answer questions. So, let us know what your questions and comments are. And then, check us out at ennischiropractic.com. You can learn more about the staff and the practice and our really, really simple process for how you can learn more about how we can take you where you are and get you where you want to be so you can really thrive in your life and enjoy the things that matter. All right.
Have a
All
great
right,
one.
doctor. All right. We'll talk to you soon. Bye bye.